a renal patient, I was told by a reporter who wrote books who lost a son with CJD, there's a disclaimer on the blood bags now saying that if you have this blood, you may have pathogens. A disclaimer on a blood bag that you're not told about is nothing. That's just trying to prevent another inquiry like this 30, 40 years down the line. They need to be informing people and giving them choices. Not always is a blood transfusion necessary. Sometimes it may be, sometimes it's not. But at least tell the patients that are receiving them the risks that they're taking so that you can choose.
And also, I think, is the fact that Sir Brian has pointed to the lack of candour and openness regarding all the entire state on this issue, and that all needs to change. And I think institutions shouldn't just say they are being, you know, they're working within those rules anyway, because it's evident that isn't happening. And it's ministers are involved, it's right the way through the state, it's a complete failure. And had there not been a cover-up and the line adopted and the line defended, we wouldn't all be sitting here 40 years later doing this, and we wouldn't have lost all the people we've lost.
Hi, I'm Susie Forrest from BBC Scotland News. A couple of things you've sort of said you've not learned anything that you didn't already know, and those of us who have been interviewing you all these years have heard you say all these things many times. So I suppose that's one question: is there anything new in this that you didn't know that you've discovered? And also, from what you've been saying, a lot of what will be required to take any of this forward will actually be up to the devolved governments, and you know, all the attention will be on the Westminster government today and tomorrow perhaps, but how do you want to see them work together with the governments in Scotland, Wales and Northern Ireland to deal with some of the things you've been talking about, whether that's the way the health service works or education? Well, the government in Scotland, to their credit, I mean, they set up the SIBSS, which is the Scottish Infected Blood Support Scheme, and they were, you know, the forerunners of that. And that has been a godsend to people, having that amount of money coming in. They know they're going to get it. They've got a, you know, finite. It's like getting your salary, although these people can't have a salary because they're not well enough. You know, they've been made ill by the treatment. So the Scottish Government, to their credit, as I say, set up the Scottish Infected Blood Support Scheme. That's been working very well. Where we go from there with the devolved government, I mean, I wouldn't hesitate to guess, but we're hoping that things can go on as they are for the foreseeable future. Because, I say, people are dependent. People are dependent. It's given them a security. People who lost their jobs, people who weren't well enough to work, they didn't have any financial security anymore. They couldn't get insurance. They couldn't get mortgages. And this has given them something that has to be sustained for the mental welfare as much as their physical welfare.
When I spoke to Minister Glenn in Belfast with two of my colleagues, we pressed him, the first issue we pressed him on was giving statutory cover for the daily living allowance that he provides on a monthly and quarterly basis. The authority for that will hand over to the independent authority, compensation authority, and legislation will change in the respective regions to accommodate that. We have BSO, which is the Business Services Organisation, not unlike our colleagues in either region. That works very well for us. We have established, in conjunction with the Department of Health, a practical stakeholders group, which I myself have had the opportunity to chair as a victim, and which is co-chaired by one of the senior civil servants who deals specifically with infected blood. We have a good working relationship. The Health Committee in Northern Ireland wants to work along in partnership with the victims, and I've been asked to address them at formal sitting in relation to victims' views on the victims and prisoners legislation and how that is going to apply in Northern Ireland. In Northern Ireland, it's a slightly different situation because, as in Scotland and in Northern Ireland, the legislation primarily for prisoners, etc., was UK-based, but it was England and Wales. So our Secretary Health Department and our Minister for Health and our committee have been working closely along with ourselves in lobbying at Westminster to try and make positive things happen so we are included in the UK process and not excluded. That applies both in Scotland and Northern Ireland. Our Assembly operates differently. It has different rules and regulations. It has different capacity to provide its own source of income. So we want to see the continuation of the commitment to the victims that this Minister, Robin Swan, has shown, and also the Health Committee as it currently sits. And that will give us confidence in the local work that the Assembly is doing to include us in this process as they take over their responsibility.
So in Wales, we'd just like them to, we'd like Sir Brian's interim report recommended on compensation, and I don't really think we can comment on it because we don't know what the government's going to do with it, and that will give us many sleepless nights. So, you know, I met with John Glenn 2 weeks ago and I took the list of the 28 people who have never been included in a scheme, have never been given any compensation at all. And Sir Brian's recommendations is that those payments should be made through the current support schemes. So there's no delay, and government needs not to delay this and not wait for the scheme to be set up. So that's so the parents of the 380 children across the UK can get the payments quickly, and the children who lost their fathers. And I think that's an urgent requirement. Sorry, I had to get that in because I thought we hadn't mentioned enough about the